So the doctor will have to test you and find out which STI, because there are a range of STIs.
Globally, women and young girls are mostly at a higher risk of contracting sexually transmitted diseases. Data on the prevalence of STIs indicate chlamydia is 4.5%, gonorrhea 9.0%, trichomonas 8.0%, and syphilis 4.0% in female, while in male, chlamydia 4.7%, gonorrhea 5.7%, trichomonas 0%, and syphilis is 2.8%. Studies also found that 20.6% of female and 13.2% of male have at least one STI. In Uganda, HIV/AIDS still affects the females more than male, and the overall HIV prevalence stands at 5.7%, whereby 66% of the daily HIV new contractions are recorded among the adolescent girls aged between 15 to 19 years.
As long as one involves themselves in unprotected sex, be it anally, vaginally or orally, or probably if they get intact, they touch the genitals, this person can acquire a sexually transmitted disease from there. People know just a few of them, but if you come to the experts, they will tell you a number of them. We have what we call the chlamydia, we have gonorrhea, we have chancroid, we have HIV, we even have hepatitis A, B, and C. We have the herpes simplex virus, we have the human papilloma virus infection, which is responsible for even cervical cancer and genital warts. We have syphilis. We have quite a number of these STIs. First of all, HIV is human immunodeficiency virus. When this virus attacks your body, it weakens it. And when it weakens it, it renders it to opportunistic infections, whereby a person can move from a stage where there are no symptoms that you acquired the virus to a stage where you start developing this and that. A stage where it is evident symptomatically that so and so, or this particular individual, might have acquired HIV. We also have to understand that HIV, much as is sexually transmitted, but there are also other ways through which we can transmit it to people. Through accidents. If I get involved in an accident and I'm HIV positive, whosoever will get exposed to my blood will be at a high risk of acquiring HIV. Mother-to-child transmission. A mother can transmit HIV to the child during pregnancy, at birth, or during breastfeeding.
I was born with HIV. My parents were positive. I actually lost them at 1 year and 11 months. So when I found out from my auntie, whom I call my mother. She told me I was positive, so I got it through my mother, meaning I was born with it. By then, there were no preventive measures and people knew nothing about prevention and elimination of mother to child. So that's how I got it. At first, before me knowing HIV, I was very free. Like, I used to take my medicine very well. People used to ask me, my mother told me I have a stomach ache, so whenever that stomach pains me, I take my medicine, but on a daily basis. Then after, actually before, we had I was in P3, I recited a poem about HIV, and I knew what HIV was, how it's transmitted and everything. So when she tells me that I'm positive, she tells me it was so very hard for her on her side first. I asked her many questions, we are two, and I'm the only one positive. My elder brother is negative. So there are a lot of questions. And on my side, I had no challenges. Like, I kept on taking my medicine, not until when I got into stigma by my brother. He was treating me in a certain way, of which it was like he was blaming me for having HIV, and him is negative. And at school, my HM knew what I was, of which he was also positive. So he used my image to hide himself and told the choir, my fellow choir members what I was. So when one came to me and asked me, from there I stopped taking my medicine, which affected me. But then later on, when I was guided and supported psychically, I regained.
The way to handle HIV positive people depends on the communities they are in. If it is at the hospital community, the hospital has its system on how it handles them. If it is in the, where they stay, even the community there must learn how to accept people like the way they are, because nobody chooses to become HIV positive. Let me go back a little bit to the health facility. When someone turns out to be HIV positive, this is what we do. Before even testing, counseling is given. It is key. When the result come out positive, still counseling is emphasized. Why? We want to eliminate things like suicidal thoughts. We want to eliminate the why question. 2, we want this person to accept who they are and the change that has come. We want to let them know how they are going to live on with life. We want to teach them how they are going to be taking the medications and what is the purpose of the medicine, and to give them a positive outlook about this new status, that we can live, we can achieve more, we can do everything that we have ever dreamt to do with this status. It is about a new perspective of it. Abstinency is the best way one can protect themselves from being exposed as far as sexually transmitted diseases and HIV is concerned.
Someone can also acquire STIs without any involvement in sexual intercourse. That's why both young boys and girls are always advised to maintain proper hygiene and avoid sharing personal items.
There are times when we get itchings. A young person could get itchings when he or she has even never had sex. It could be hygiene. The young boys put on a biker, put on a short, they add on a jean trouser. So there's a lot of heat. So in terms of a lot of heat, also it could bring itches. And then there are others also who use like razor blades for shaving, because it's not advisable for us to use razor blades within our pubic area. All we need to use is a pair of scissors. There are small scissors that you can do. The moment you use a razor blade, you develop blisters and then they itch. But in case you scratch them, they burst and something comes out, but it remains open as a wound. So in case of any contact, you could easily get infected.
In case you notice small body itches and discomfort, talk to a close friend, parent, or teacher to help in consultation of a medical doctor for early treatment. In conclusion, you can learn more about sexual and reproductive health and the best way to avoid STIs and STDs through practicing ABCs of safer sex. A, meaning abstinence from sex. B, which is being faithful to one partner. And C, for proper use of condoms. But all these depend on your age, attitude, culture, and religion. Always remember, prevention is better than cure.